in terms of risk-rated subsidies. If you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass.
It may sound insulting and you might be tired of it already. Certainly there are those of you who hope you forget it as soon as possible. But you, the American public, according to him, you're stupid. At least when it comes to the Affordable Health Care Act and in the opinion of certain people connected with the law. Jonathan Gruber's words made him a lot of money and cost him his job recently as an advisor, setting up Vermont's state-run health care system. But for small businesses and others, it won't be so easy and fast in getting away from the edicts of Obamacare. Let's welcome to MidPoint President and CEO of the Pacific Research Institute, a San Francisco-based think tank dealing with healthcare issues and much more. Also author of The Pipes Plan, the top 10 ways to dismantle and replace Obamacare. Sally Pipes joins us today. Sally, thank you so much for being here.
Well, thank you for having me on.
Pleasure, Sally.
A lot of exciting things going on.
There's a lot of exciting things going on, but I do have to start right now with the Gruber comments before we dig into the book and some of those 10 ways. Because don't we have to be honest in many ways and say, while the public might be tired of hearing about it, while a lot of the left-wing media might be saying that it's being overdone in many ways, boy, I hate to say this, Jonathan Gruber is right. It's a stupidity here because, let's be honest, many of the American people heard about it. They heard the surface news about Obamacare. They thought it was great, voted for it, never researched it at all, and went with it hook, line, and sinker.
Well, I mean, as you know, I mean, the law was passed without a single Republican vote. The Democrats really pushed it through. Remember Nancy Pelosi?
Yep. We
have to pass this bill so we can find out what's in it. In March of this year, it's going to be a winning issue for the Dems in the midterms. And of course, I think what we really need to think about in Grubergate, I mean, Jonathan Gruber is just being now with the modern technology, videos are coming forward about, the real statements he made about the federal subsidies only being available to people in the state-based exchanges. And the reason they did that was because they wanted the states to set up the exchanges. I think Obama and the team had no idea that 36 states and the District of Columbia would go with healthcare.gov and not set up their own exchanges. So Gruber, because of modern technology, has really been outed on what was really going on. And I think the bigger issue was that they said that if the CBO, wrote into the, analyzed it and said these were tax increases, the whole thing would have died. I mean, the American people are smarter than we think. The American public is not stupid. 54% of Americans, pretty much since the law became law in March of 2010, have been opposed to Obamacare. A new poll just came out from Gallup this week showing that only 37% of the people they polled support Obamacare. And the election results, endorse that.
Now, we should point out, yes, I think it's fair to say that there are some people out there who are doing well with Obamacare. I've gotten letters from a number of them. People say it's working, but that is a minuscule amount compared to what's happening here to the individual, to the rise in premiums, and the small businesses as well. The small businesses are taking this on the hammer right now. So is there anything that they can do? There really seems that they're helpless. You're handcuffed at this point until something happens with this law.
Well, I think a number of exciting things could happen. They had to downgrade the number from 8.3 million who'd signed up on the exchanges to 7.1 million. That's going to come down another 150,000 because a lot of those people, about 100,000, 110,000 were actually illegals that signed up, so they can't be part of Obamacare. So the number is a lot less. But if you take that 7.3 million, 87% of those people who are in that number are people who qualified for subsidies under Obamacare. And of course, a lot of them are on those 36 states and DC that are on healthcare.gov. So that's a really important thing. I think, the election results were very good. I am, of course, fully in favor of full repeal and replace. And I'm hoping that Congress this spring will vote to repeal and replace. I know it won't happen. It won't be fully repealed because the president has the pen to veto this, but I think they need to make Republicans with the majorities in the Senate and House need to let the American people know they heard what they said in the elections and that they're in favor of this. There's also another aspect, budget reconciliation. Some of the things could be repealed under budget reconciliation. things like the medical device tax, that 2.3% tax on gross sales, IPAB, the Independent Payment Advisory Board, that has never been made operational. So there's a number of things there. I think, but we really then need to look forward to the election of 2016, the presidential. Then early in 2017, if the Republicans have a good president, a candidate who wins, they keep the Senate and the House, then we can move forward with a full repeal agenda, such as changing the tax code so that individuals get the same tax advantage as those who have employer-based coverage. We need to, modify, update Medicare and Medicaid. Those two programs are going bankrupt. We need to voucherize them. When the programs were set up in 1965, people only lived to age 65. Today, the average American lives to 79. And so it's a very expensive program, which is going to go bankrupt. We need to allow people to buy insurance across state lines. We need to do medical malpractice reform. We need to get rid of these expensive, costly mandates that add 20 to 50% to the cost of a premium. And, people today are finding out they're paying more for their premium, their deductibles are much higher, and they don't have access to the hospitals and doctor networks that they thought they would under these exchange plans.
I've only got about a minute left here, so I just need to ask you this. You had a lot of ifs in there, great ideas on this, but the ifs certainly tell me and might tell others that we're not going to see a real sea change here for anywhere from 2 to 5 years or maybe even longer, which means this is going to be around for a while, and we got to learn to live with it.
Well, there's one even more exciting thing is that the U.S. Supreme Court decided a couple of weeks ago to take the King v. Burwell case on, which is the issue of, are the federal subsidies eligible for those people who are on the 36 states under healthcare.gov. If the Supreme Court, and I'm hoping that John Roberts will make the right choice this time, even John Gruber said CBO can't cost these things out as taxes. John Roberts said in the decision in 2012 that it was the individual mandate was constitutional under Congress's power to tax. If the court rules that the subsidies are not there for people on healthcare.gov, the federal exchanges, this is going to cause right away, probably June of 2015, the implosion of Obamacare. The employer mandate and the individual mandate are going to fall, and that will be that. So that is the most exciting thing on the horizon right now.
There you go. We're going to have to stop it there, unfortunately. Remember, the book is called The Pipes Plan, The Top 10 Ways to Dismantle and Replace Obamacare. Sally Pipes, great font of information. Thanks so much. We'll do it again soon.
Thank you. Bye.
All right. Short time, and we're back with the latest news and numbers from Wall Street on MidPoint.